Aging is an inevitable journey marked by transformations in every system of the body, and the penis, as a reflection of overall health, undergoes its own set of changes. Over time, men may notice a reduction in penile length, diminished erectile firmness, and a slower response to stimulation. These shifts, while natural, can stir concerns about self-image and intimate relationships. However, these changes are not insurmountable barriers to a fulfilling sex life. By understanding the biological, psychological, and lifestyle factors at play, and adopting targeted strategies, men can mitigate these effects and preserve, or even enhance, their sexual vitality. The process begins with acknowledging that aging is not a defeat but an opportunity to refine habits, deepen connections, and leverage medical innovations to sustain intimacy and confidence. The penis, like all organs, is subject to the wear and tear of time. Structurally, the smooth muscle tissue within the corpora cavernosa, responsible for engorgement during erections, gradually diminishes and is replaced by fibrous tissue. This process, termed fibrosis, reduces the penis's ability to expand fully during arousal, leading to softer erections. A 2020 study in the Aging Male Journal found that by age 70, men experience a 20 to 30% reduction in smooth muscle content within penile tissue compared to their 30s. Concurrently, the tunica albuginea, the fibrous sheath surrounding the erectile chambers, loses elasticity, further contributing to a less rigid erection. These anatomical changes are compounded by vascular alterations. The endothelium, the inner lining of blood vessels, becomes less efficient at producing nitric oxide, a molecule critical for dilating arteries and allowing blood to flood the penis. Research in hypertension highlights that oxidative stress and chronic inflammation, common in aging, accelerate endothelial dysfunction, creating a double burden for erectile health. Hormonal shifts, particularly the decline in testosterone, play a pivotal role in sexual aging. Testosterone not only fuels libido but also maintains the health of penile tissue by promoting collagen synthesis and nitric oxide production. A longitudinal study in the New England Journal of Medicine tracked men over a decade and found that those with testosterone levels below 350 Ing/dL were twice as likely to develop erectile dysfunction, ED, compared to men with higher levels. Beyond libido, low testosterone correlates with increased visceral fat, which secretes inflammatory cytokines that impair vascular function. This visceral fat often accumulates in the pubic region, creating a buried penis effect where excess adipose tissue obscures the penile shaft, making it appear shorter. However, testosterone's role is nuanced. While replacement therapy, TRT, can reverse symptoms in hypogonadal men, a 2022 meta-analysis in Endocrine Reviews cautioned against indiscriminate use, noting that TRT may worsen sleep apnea or prostate issues in susceptible individuals. Instead, lifestyle interventions, such as resistance training, which boosts testosterone by 15 to 20% after 6 months, offer a safer, sustainable path for many. The mind-body connection in sexual health cannot be overstated. Psychological factors like stress, anxiety, and depression often exacerbate physiological challenges. Chronic stress elevates cortisol, which suppresses testosterone and constricts blood vessels, creating a vicious cycle where anxiety about performance worsens erectile function. A 2021 study in psychosomatic medicine revealed that men with high stress levels had a 45% higher likelihood of developing ED within 5 years compared to their less stressed peers. Cognitive behavioral therapy, CBT, has proven effective in disrupting this cycle. By addressing catastrophic thinking, if I fail once, I'll always fail, men can reduce performance anxiety. Similarly, mindfulness practices, such as body scan meditations, enhance present moment awareness during intimacy, shifting focus from performance to sensation. A 2023 trial in JAMA Network Open demonstrated that an 8-week mindfulness program improved erectile function scores by 22% in men over 60, underscoring the brain's power to influence physical responses. Communication within relationships is another cornerstone of adapting to age-related changes. Many men retreat into silence, fearing that acknowledging sexual changes will undermine their masculinity or disappoint their partner. Yet, avoidance often breeds misunderstanding. A survey by the Journal of Sexual Medicine found that 65% of partners misinterpret reduced sexual activity as a lack of attraction, fueling emotional distance. Conversely, open dialogue fosters collaboration. Couples who discuss their evolving needs often discover alternative forms of intimacy, such as sensual massage, shared fantasies, or extended foreplay, that prioritize connection over performance. Sensate focus exercises, developed by Masters and Johnson, encourage couples to explore touch without the goal of penetration, reducing pressure and rekindling emotional bonds. A 2022 study in Archives of Sexual Behavior reported that couples practicing sensate focus for 12 weeks experienced a 40% increase in relational satisfaction, highlighting the profound impact of intentional, pressure-free intimacy. Nutrition emerges as a powerful tool in preserving sexual health. Diets rich in flavonoids, found in berries, citrus fruits, and dark chocolate, improve endothelial function by scavenging free radicals and enhancing nitric oxide bioavailability. A 2021 trial in Nutrients found that men consuming 500 milligrams of flavonoid-rich cocoa daily for 3 months saw 15% improvement in erectile rigidity. Omega-3 fatty acids, abundant in fatty fish like salmon and mackerel, reduce arterial inflammation and improve blood flow, while zinc, abundant in oysters and pumpkin seeds, supports testosterone synthesis. Magnesium, often overlooked, relaxes blood vessels and improves nerve signaling. A 2019 study in the American Journal of Clinical Nutrition linked higher magnesium intake to a 30% lower risk of dehydration also plays a role. Dehydration thickens blood, impairing circulation, while adequate water intake ensures optimal mucosal moisture, maintaining penile sensitivity. Physical activity remains one of the most potent interventions. Aerobic exercise, such as swimming or jogging, enhances cardiovascular efficiency, ensuring robust blood flow to the pelvis. A 2023 study in the Journal of Urology found that men who walked 10,000 steps daily reduced their ED risk by 50% compared to sedentary peers. Resistance training, particularly compound movements like squats and deadlifts, stimulates testosterone production and growth hormone release, which aid muscle preservation and fat loss. Pelvic floor exercises, or Kegels, are equally vital. The bulbocavernosus muscle, which contracts during ejaculation, also helps maintain erection firmness by trapping blood in the penis. A 2020 randomized trial in urology showed that men performing 3 sets of 10 Kegels daily for 6 months experienced a 35% improvement in erection sustainability. Even posture matters. Chronic slouching compresses pelvic blood vessels, while standing or sitting upright promotes circulation. Sleep, often neglected, is a linchpin of hormonal and vascular health. Deep sleep stages are critical for testosterone production, with studies showing that men who sleep fewer than 5 hours nightly have testosterone levels akin to those a decade older. Sleep apnea, prevalent in 1 in 3 men over 50, fragments sleep and starves the body of oxygen, exacerbating endothelial dysfunction. Continuous positive airway pressure, CPAP, therapy not only improves sleep quality but also restores testosterone levels and erectile function in 60% of users, per a 2022 study in Chest. For those without apnea, prioritizing 7 to 9 hours of sleep and maintaining a cool, dark bedroom environment can optimize hormonal balance. Medical advancements offer hope for those needing additional support. Phosphodiesterase 5 inhibitors, PDE5s, like sildenafil remain first-line treatments, but newer agents like avanafil offer faster onset and fewer side effects. Low-intensity shockwave therapy, LIST, a non-invasive procedure using sound waves to stimulate blood vessel growth, has gained traction. A 2023 meta-analysis in European Urology found that 70% of men undergoing LIST regain spontaneous erections, with effects lasting up to 3 years. For severe ED, penile implants provide a permanent solution, with modern inflatable models offering a 95% satisfaction rate due to their natural feel and reliability. Emerging therapies like platelet-rich plasma, PRP, injections and stem cell treatments aim to regenerate damaged penile tissue, though these remain experimental and require further study. Redefining intimacy in later life involves embracing a broader, more holistic view of sexuality. For many, maturity brings liberation from societal expectations, allowing couples to explore intimacy beyond traditional intercourse. Techniques like tantric breathing, which synchronizes breath with touch, can heighten sensory awareness and prolong pleasure. Non-penetrative practices, such as mutual masturbation or erotic storytelling, reduce performance pressure while fostering emotional closeness. Technology, too, plays a role. Wearable devices like the Lioness vibrator track physiological responses, helping couples understand arousal patterns, while apps like Blue Heart offer guided intimacy exercises tailored to aging bodies. Ultimately, aging invites a shift from performance-centric goals to a focus on joy, connection, and adaptability. Regular health screenings, monitoring blood pressure, cholesterol, and blood sugar, can preempt vascular issues that undermine sexual health. Mental health care, whether through therapy or support groups, addresses the emotional toll of aging, reinforcing self-worth beyond physical metrics. The digital resource Rediscovering Intimacy, Healthy Sexuality After 60, as recommended by Dr. Elis Rossi, provides actionable strategies for this transition, emphasizing that sexual fulfillment is not a relic of youth but a dynamic, evolving experience. In closing, the journey through aging and sexual health is deeply personal yet universally navigable. By integrating scientific insights, proactive habits, and compassionate self-acceptance, men can reclaim agency over their intimate lives. Whether through mindful nutrition, cutting-edge therapies, or reimagined intimacy, the later years can be a chapter of discovery, resilience, and profound connection, proving that vitality, in its truest sense, knows no age. Reflect on these insights. How might small dietary tweaks or a candid conversation with your partner reshape your intimate journey? Share your thoughts below, and if this resonates, consider liking the video to amplify its reach. Every step toward understanding and adaptation is a victory, affirming that aging, while inevitable, is not a surrender but an evolution, one rich with possibility for those willing to embrace it.